My name is Dr. Naghib Bogere. I'm a medical oncologist at the Uganda Cancer Institute. I'm part of the team that treats breast cancer at the Uganda Cancer Institute. What is breast cancer? Breast cancer is a disease that comes when cells in your breast start dividing abnormally, and they even get characteristics that allow them to spread from the breast to other organs like the lungs, like the liver, and the bones. Breast cancer is the second most common cancer among women in Uganda, and at the Uganda Cancer Institute alone, every year we get a minimum of 800 new breast cancer patients. In Uganda, we have over 2,000 new breast cancer patients every year, and breast cancer is one of the highest causes of death, cancer-related death among women in Uganda. Breast cancer can also affect men. It's just that the ratio of men is less than that of women, but breast cancer can also affect men. Breast cancer, when caught early, is very curable, and it's important that we focus our energies on screening and early detection of breast cancer, and that is the theme of this Breast Cancer Month. How do you know that you have breast cancer? Breast cancer most times doesn't have symptoms. You can have breast cancer when your breast feels totally normal, and that means that the only way of catching it is through screening. Later on, as the breast cancer continues to grow, you may feel a lump or a mass in your breast, something hard in your breast. Sometimes the skin of your breast will change and it will give off that orange peel appearance. Other times you may feel swellings in your armpits. Other times you may get abnormal fluid coming out of the nipple of your breast, or other times you may see the skin of your breast dimpling. But I would want to encourage everyone not to wait for symptoms, as I said, and instead screen in order to catch this breast cancer before we get the symptoms. How do we screen for breast cancer? Breast cancer is screened mainly using three methods. The first method is called the breast exam, the clinical breast exam. This is when you come to the hospital, like Uganda Cancer Institute, and the hospital provider examines your breast using their hands. If there is any lump, many times the hospital provider will be able to fill that lump. But also this breast exam, we encourage you to do it at home every month, whether you're a man or a woman, in order to catch these lumps early. The second screening method is called a mammogram. A mammogram, they use X-rays to take images of your breast. And most times, when they are very small masses that even your hand or your fingers can't feel, the mammogram will be able to detect them. We usually do these mammograms for ladies aged 40 years and above. So if you're at home and you're 40 years and above, and you haven't done a mammogram this year, we encourage you to come to the Uganda Cancer Institute and have your annual screening mammogram. The third method is a screening breast ultrasound. Here we use an ultrasound to screen your breast and see whether there are any masses that we can detect early. Many other times we can use a machine called an MRI, but that is only reserved for special cases. When we make a diagnosis of breast cancer, many times we have to take off a sample of that mass that we found in your breast. That sample will help us know the type of breast cancer that you have, because we know that we have about 6 types of breast cancer, and the treatment of each of those types is different. When we get to know the type of breast cancer that you have, we do some tests to know which stage your breast cancer is, to know whether it has spread or not. And those tests include things like a CT scan, and they may include other things like an ultrasound or an X-ray. Breast cancer has 4 stages. The first stage is stage 1, which we prefer to catch all our patients. Because when you have stage 1 breast cancer, the chances of cure are over 95%. Stage 2 is when the breast cancer has now started becoming a little bigger. Stage 3 is when it is substantially big, but it has not yet spread to any other organ. And stage 4 is when this breast cancer has spread to another organ that is not the breast, organs like the lungs, organs like the bones, organs like the liver. And we use this stage to decide the kind of treatment we are going to give you. When we are treating breast cancer, we use about 5 modalities. The first modality of treatment is surgery. When you have breast cancer and it is still in one place, when it is still stage 1 or 2, many times we can do a surgery to cut out the entire breast cancer and also cut out any lymph nodes that it may have affected, and that increases the chances of curing this breast cancer. After surgery, we send you for another treatment modality called radiotherapy. Radiotherapy is where we use a machine that produces rays, and these rays kill breast cancer cells that may be remaining after the surgery. That treatment is available at the Uganda Cancer Institute. We also have a modality called chemotherapy. Chemotherapy is where we use medicines that kill the cells that are dividing very rapidly, and usually those are cancer cells. So we give it through the vein, and the reason we give it is to kill any cancer cells that have started spreading throughout the body. We know that if you have cancer that has spread beyond the breast, for example to the lungs, to the liver, we cannot operate the breast, the lung and the liver at the same time. Instead, what we'll do, we'll give you a treatment that spreads throughout your body to kill all the cancer cells that have spread and increase our chances of survival. The 5th treatment is where we use biological treatments, which include hormone therapy. We know that breast cancer some types of breast cancer respond to treatments that block hormones like estrogen. So sometimes we use those treatments to kill the breast cancer cells. We also have another treatment called immunotherapy, where we give you treatment that tries to remind or teach your white blood cells how to fight this breast cancer. October, the breast cancer month, we use it a lot to spread awareness about breast cancer. That way, if there is any woman or any man who has not tested for breast cancer this whole year, please use this chance. Come to Uganda Cancer Institute this month and have your breasts tested, have your annual mammogram or ultrasound as the doctor may advise.